Britain's Princess of Wales, Kate Middleton, has been praised for the video released Monday announcing that she'd finished preventative chemotherapy treatment. It came some 6 months after she dramatically revealed in another video that she was being treated for an undisclosed type of cancer. Now, while sharing the royal family's medical updates may seem invasive or like fodder for the gossip pages, it actually has a real public health benefit. Kate's initial announcement of her diagnosis sparked a surge in visits to cancer charity websites as well as to the UK's National Health Service. Well, for more, we can speak to Thalie Martini, the Chief Executive Officer at Breast Cancer UK. Thank you so much for taking the time to speak with us. First, does your organization tend to observe an uptick in visits or donations after public figures like Kate Middleton speak publicly about cancer diagnoses?
Yes, absolutely, and thanks for having me. Well, at Breast Cancer UK, what we notice is that when high-profile figures such as Kate Middleton or the many others that are now speaking much more candidly about their cancer diagnosis, when they speak up about their cancer, we see a notable increase in the demand for breast cancer information, in particular prevention information, because that's the information we provide. So we have a prevention quiz, for example, so we see a much larger uptake in our prevention quiz, and that allows people to look at ways in which they can produce their own breast cancer prevention plan. So we see this as being very good news, really, this move and this shift really in attitude that a lot of high profile figures have now in talking candidly about the struggles that they go through and appealing directly to the public is good news, because what it does is it helps raise awareness. And the more people are aware about cancer, the more motivated they might be, firstly, to seek out advice, to go to a health professional where they need to, but importantly, to look at ways in which they can start to protect themselves from certain cancers, such as breast cancer, because we know that with breast cancer, around 30% of cases can be prevented. But awareness is the first thing that gets people to the information that we provide and to help them make those changes.
And do you think that with the rise of social media, perhaps people are becoming more comfortable speaking out about intimate issues, including cancer diagnoses, or does the topic remain somewhat taboo?
Well, I certainly think social media and the influence of many of the celebrities recently who've come out, some of whom have been fairly young or very, very outspoken, that certainly does reduce the taboo. I think the only issue really to highlight sometimes is that there can be misinformation, and the first place we tell people to go to is to trusted places such as the NHS or charities such as ours, where we produce scientifically backed information. Because while it's a great thing to talk about cancer and to look at ways in which we can deal with cancer issues, it's also really important to be properly informed.
And when you say that, is there any kind of specific piece of misinformation that you're thinking of that maybe you want to debunk?
Well, I think there are lots of myths that are out there and people can start to panic. So if we look at breast cancer, which is our area, some myths that people might hear about is things like underwire bra, for example. If I wear an underwire bra, can that increase my risk? And there could be a number of other things, other rumors that go around. And these things can be very easily propagated on things like social media. So when in doubt, we always say, go to the NHS, really trusted place, come to Breast Cancer UK and other trusted cancer charities to make sure that you understand the facts when it comes to any cancer diagnosis. And when it comes to breast cancer prevention, we have lots of information and practical support we can offer people. So what we want people to do is to be informed, not panic, because sometimes there could be information out there that isn't reliable. And some high-profile figures might say things about ways of avoiding treatment, for example. And what we say to people is that every case is individual, and please make sure you go to a trusted source.
And just how important is early detection in terms of increasing survival rates when it comes to breast cancer?
Well, breast cancer actually, we've had some tremendous advances over the past 50 years in treatment and care, which means that early diagnosis is key to ensuring that people can make a full recovery, because the chances of a full recovery with breast cancer is very high, provided that we detect a cancer as soon as possible. So there are lots of things that we talk about in terms of protecting ourselves. So there are prevention steps we can take, such as making sure that we have a healthy diet, that we are physically active, but also that we know our breasts, that we check our breasts, and when in doubt, go and speak to your health professional, because if a breast cancer is detected early, there's a very, very good chance that the treatment outcomes will be really positive.
Earlier this year, U.S. health authorities lowered the recommended age for the first breast cancer screening to 40. Is that in line with your organization's guidelines as well? And why has it been shifted to younger women?
That's not the guidelines in the UK. In the UK, 50 is the age when women first get called to the NHS for their screening program. And there's lots of new science and new research now happening into screening programs, and potentially looking at people who have a higher risk. They may be invited for screening earlier on, so people who have the family history, for example. But in terms of the general population, one thing about breast cancer is that it's a disease that becomes more prevalent the older we get. So age is a really key factor. And that is what influences also the screening program in the UK. So in the UK, it's 50, and we support the screening program in the UK, and we recommend people, once you are called up for your screening from the age of 50 onwards, then we recommend that you take it up.
And what's your advice to people for staying on top of their cancer screenings? Because I think when people, believe that they're healthy, that's something that they might not be prioritizing.
Yes, well, I mean, in the UK, people are called up, so they will receive a letter, an invitation to go to their screening. But just generally being aware of breast cancer risks. So as I mentioned earlier on, if we are aware about ways in which we can reduce our risks, so for example, as I said, eating a healthy diet, being involved in regular physical activity, checking our breasts, making sure that we check our breasts about once a month, at the same time every month, so that we can detect any changes, and then going to see our GPs if we do see a change. But keeping on top is really about taking up that invitation. Once the invitation comes through, go along and have your breast screening, because as I said, early detection is key. And also a lot of breast cancers are discovered by people themselves through regular breast checking.
All right, Thalie Martini, thank you again so much for joining us today. That's Thalie Martini, the Chief Executive Officer at Breast Cancer UK. And it's time now for a look